Hi, ACR 2020. I'm Dr. Rachel Tate coming to you from my home in West Palm Beach, Florida. Dr. Vladimir Layarsky discussed 11 pearls for outpatient billing and coding from ACR session 3S017. Now, 11 is great, but I want to take a couple of minutes to highlight just a few of these for your importance. Number one, a new patient is someone you have never seen or with whom you have not had a visit in 3 years or longer from the actual date of visit. And this includes inpatient visits. So just remember that. Number two, an alternative strategy for your HPI is actually listing the problems and then adding a brief separated history for each of those particular problems. That you can do instead of the novel-esque storytelling, which I like to do. So consider this for your charting purposes. Number three, in order to gain points for record review or vaccination records, reviewing labs, imaging, or taking history from another person who's in the room post-COVID, after obviously all of this, but from another person who's in the room, you can also make sure, and you need to do this, you need to make sure that you state the context and the date of all of that information. It's not enough to just state that you did this. Number four, I'm going to call these easy points. Easy points, social, family, and smoking history. All of these you need to include in your HPIs, or pardon me, not in your HPI, but in your actual documentation, because you can be penalized if you forget them. Underbilling to CMS is just the same as overbilling, so don't do it. Overall, remember that good medicine does not imply good billing and vice versa. So these are just a few quick tips that I learned from Dr. Layarsky. For more information and news from ACR Converge, be sure to visit us at roomnow.com and follow me on Twitter at UpToTate.